Hello guys, this is Dr. Said Hamid. I've come with a new video in Dr. Dentist. Today I would like to talk about pulp cupping. Pulp cupping is a topic related to operative dentistry. Pulp cupping has got two lectures. This is the first lecture and I'm gonna soon make the next lecture, the second lecture too. So what is pulp cupping? As you know, in deep carious lesion, the carious is near the pulp, so pulp needs a protection because the pulp is in peril, the pulp is in danger. So we do some procedures to protect the pulp. This is called pulp cupping. Pulp cupping means we cover the pulp, we cap the pulp. Pulp cupping has got two kinds. One is called direct pulp cupping or DPC, and the next one is indirect pulp cupping or IPC. In this video, I'm talking about indirect pulp cupping. So, what is indirect pulp cupping? Indirect pulp cupping is the procedure performed in a tooth with deep carious lesion adjacent to the pulp. This is a tooth, this is the carious, this is a deep carious lesion. This is adjacent to the pulp. Okay, it means it is near to the pulp, but the pulp has not been involved. The pulp is vital. So what do? We remove all the infected carious dentin. We remove it, okay, leaving behind the soft and smooth dentin. That's called affected dentin. So you should know the difference between the affected dentin and the infected dentin. The affected dentin is soft and smooth, okay, but the infected dentin is hard. Okay, it's hard and harsh. That is why we remove the infected dentin, but the affected dentin is left behind to the pulp. So why do we do this? Because to avoid pulp exposure. To avoid pulp exposure, that is why we remove the infected dentin, but affected dentin, a thin layer of affected dentin is left behind. Okay, we come to indications. When can we do this procedure? First, in deep carious lesion near pulp but not involving it. As you see in this picture, this is a deep carious lesion, okay, but a pulp has not been involved. That is why we can use it. Next, we've got 5 no's. First, no mobility of the tooth. It means tooth shouldn't be mobile. No periodontal disease, okay. Next, no history of spontaneous toothache. It means the patient should not be complaining of the night toothache or night tooth pain. No tenderness to percussion. If we percuss the tooth, the patient should not be tender. The patient should not be sensitive to it. And 2, no radiographic evidence of pulp pathology. It means the pulp shouldn't be in any disease. The pulp should be vital pulp, okay? No necrosis, no irreversible pulpitis. And the next one, no radiographic evidence of resorption or radicular disease. Contraindications. Contraindications are actually and definitely opposite of indications. It means pulp involvement. If the pulp has been involved, it means pulp has been exposed. We cannot do indirect pulp cupping. If mobility present, if the tooth is mobile, we cannot do it. If the patient complains of history of spontaneous toothache, we cannot do it. Tenderness to percussion, radiographic evidence of pulp pathology. It means the pulp, if the pulp is not vital or the pulp has been involved, we cannot do indirect pulp cupping. And the last one is radiographic evidence of resorption or radicular disease. We cannot do. See, you focus. These contraindications are opposite of indications. Okay, we come to procedure. How can we do it? First, anesthetize the tooth, okay, so that the patient does not feel any pain. Next one, apply rubber dam to isolate the tooth, as you see in the picture. Next, remove soft caries either with a spoon excavator or round burr. This is spoon excavator, okay, this is so much conservative, or you can use a round burr with slow hand speed hand piece. Next one, a thin layer of dentin and some amount of carious is left to avoid exposure. As you see in this picture, this is the pulp, this is remaining carious, okay, this is left behind. Why? As I told you, this is affected dentin, this is left behind. because to avoid the pulp exposure. Next, calcium hydroxide paste is placed on the exposed dentine. Okay, this is calcium hydroxide paste. This is the green color, the yellow color is placed above the exposed dentine, and we covered the calcium hydroxide paste with zinc oxide and this is the zinc oxide. So first, the remaining carious is not removed because to avoid pulp exposure. Then calcium hydroxide paste is placed, and the last thing we do is placing the zinc oxide over calcium hydroxide. If restoration is to be given for a longer time, okay, that we do, then amalgam restoration is preferred or should be given. Above the zinc oxide we restore the tooth by amalgam. Tooth should be evaluated after 6 to 8 weeks. You can do it by a radiography. Then after 2 to 3 months, okay, the cement, okay, first the amalgam, then the cement is removed, okay, and the tooth preparation is evaluated. If due to remineralization, as I told you before in varnish, liner, and base lecture, okay, this calcium hydroxide actually stimulates tertiary dentine or secondary dentine. This stimulates it. If due to remineralization and or formation of secondary dentine, okay, the soft dentine has become hard. The soft dentine was the affected dentine, now has become hard. Then remove any residual soft debris, and then finally give protective cement base and place the permanent restorative material over it. So we come to the summary. In summary, in the first appointment, okay, this is carious. This carious is so much deep that is near the pulp, but the pulp is healthy. It means the pulp has not been exposed, the pulp has not been involved, okay. Then carious is excavated, or carious is removed from the site, okay, but the affected dentine is left behind. This is not removed to avoid pulp exposure. Then calcium hydroxide paste is placed, then zinc oxide and temporary filling, like anything, better use amalgam. In the second appointment, when is about 2 to 3 months later on, okay, about 2 to 3 months later on, the patient is recalled and the reparative dentine is formed. You can see it if you remove the cements and the temporary filling material. Then when that is removed, you remove the infected dentine and the soft dentine. Then you use liner, for example calcium hydroxide, okay. Then you use a base, a cement, a base, for example zinc oxide, and over it you can use a final restoration, for example amalgam restoration. But if you want to restore the tooth by composite, first is calcium hydroxide paste is placed, then glass iron cement is placed, and the last one is composite restoration. Thank you guys. Please subscribe to my channel. I've got a YouTube channel and a Facebook page. This is the logo. You can find notes, you can find videos. Thank you. Have a good time.